more than us.
Hi, Facebook Live. This is Florence Champagne. I'm with the Open My Heart Foundation. And just to tell you a little bit about myself, the Open My Heart Foundation, we received our 501c3 status in 2015 as a result of my own experience with heart disease. And I had to go back and forth to the hospital. I experienced some disparities in treatment. This pain went on for almost a year before I got the attention that I needed. And as a result, I like to say God gave me purpose through my pain. So I founded the Open My Heart Foundation, and our goal and our mission is to help eliminate heart health disparities among African American women and women of color. Prior to COVID-19, heart disease has been the number one killer in the United States. And African American women and women of color are at the top of the list as those who experience the most heart disease statistics and the most disparities in treatment. So our mission is to help eliminate those disparities, talk about it, educate people. We have support groups. We have healthy food giveaways. We have advocacy. So those are some of the issues. And some of the issues that we are addressing today has to do with our mental health. And I'm so glad and honored to have a few professionals on the Zoom with me today. And I'm just going to talk about them a little bit, but I want them to talk about themselves as well. And the first person I'd like to introduce is Janice Davis, Dr. Janice Davis from Howard University School of Social Work. Dr. Davis, can you just give the viewers a little bit of background, introduce yourself?
Okay. My name is Janice Davis. I am the Director of Clinical Education at Howard University School of Social Work. I have been a social worker for nearly 40 years. I trained at Howard University. I have worked with health disparities, and I have a private practice, so I work with all family issues and couples therapy. One of the areas that I have great interest in at this point is grief and loss, as well as how the social determinants of health impact our lives, both from a mental health perspective and a physical perspective.
Okay. Let me see. I'm trying to figure out how to do this at the same time. Thank you so much, Dr. Davis. So, one of the things I want to talk about today is the fact that we've all experienced a lot of loss in 2020 on a personal level. So, we're not talking about someone that we know lost someone, we're talking about immediate family members. We're talking about our close friends. We may find ourselves in a situation where it's disbelief. We're ruminating. We're thinking about it. We get stuck. We can't move forward. And people may be feeling like so much loss and grief. They're like, God, why did this happen to me? Why did this happen to me? Feelings of anger, denial, depression, and the feeling that it's not fair. I experienced all of those feelings. So we know that prolonged anger, prolonged depression will eventually start to affect your health. Can you explain the grief process? How long does it take? How do we cope with these negative emotions? Is it normal? Is there a pill to take? What's the emotional plan?
Okay. The first thing is a pill is not going to work. You're going to have to do the work. It's not going to solve itself. Grieving is a process. And there is no timeline that can be established because each individual grieves in accordance to who they are and in accordance to what they lost. So everybody starts, the cycles of grief are the same. And you can jump in and out of them at different times. So we start with denial, like, how could this have happened? When did this happen? What? Where did we get there? How did we get here in the first place? And then you're angry. And you're angry because you're frustrated. There's nothing you can do. You don't understand what's going on. And it's a constant state of confusion. Then you try to make some logic out of it. You try to bargain. You try to talk to other people. You try to make it fit into the storyline that you think makes sense, even though you still may not have accepted what was going on. The next stage is depression, because at that point it's overwhelmed and this hopelessness feeling. Where am I? How did I get here? I'm mad at the world. I want to fight everybody. It's everybody's fault, and just leave me alone. And then we gradually move into acceptance. And acceptance doesn't mean you stop grieving. It doesn't mean you're over it. It just means that you now have accepted that whatever you have lost is lost. Whatever you are grieving, you will continue to grieve, but you will continue to live as well. We often associate grief and loss with death and dying. And in light of the pandemic, a lot of focus has been placed on what people have died during this time period. And a lot of people died from COVID, but a lot of people died from other things. And what you ended up hearing was, oh, well, at least they didn't die of COVID. Well, they died. I still lost my loved one. They didn't die of COVID, but I still lost them. So I'm still in the grief process. So you also have the situations in life as African Americans, and as humans as a whole. We all have these traditions that this year have been disrupted. Everyone's life was disrupted. We are all in a grief cycle now. Let's just look at the pandemic. Denial. When we first heard about the pandemic, it was something that was happening way over there and it didn't impact us. Then we were angry because now people are starting to get sick and you're not doing anything about it. Then we're bargaining. Well, if we stay home and wear masks, it'll be okay. Then we're depressed because what we thought was going to be a 3-month stay at home now it's turned into almost a year and possibly more. And now we are gradually moving into acceptance that wearing masks have become more commonplace. We do now have to be aware of this virus. We now have to make a change. We now have to look at how will we do schools? How will we return to work? And we've accepted that this has been a fundamental change in our life. So the grief process occurs not just with the loss of a person. And all of these young people who didn't get to graduate this year, and you say, oh, well, it's okay. Well, no, it's not. We have raised them to wait for this time and to meet these milestones, and they're grieving the loss of it. And it is significant because we made it significant throughout their entire lives. So we've done some work on, and I've written an article recently on how grief and loss is affecting everyone as it relates to the pandemic, because it's not just grief and loss with death and dying.
Okay, that's some good stuff. So would you say accept the grief?
You have to work through the grief. And working through the grief is an individualized process because it's based on where you are and what's causing you to grieve. Some people are grieving because of unresolved issues that they didn't get a chance to resolve and now won't have the opportunity. Other people are grieving the companionship and loss of others. And so you will never get this person back. And you always carry this person with you. in your heart, in your spirit, and in things that you do. So as you move forward, you can't stay where you were. Life is not stagnant. Life is always moving. You can't stay in that space. So you gradually have to find a way that works for you. We can all come up with, well, you should get over it. Oh, well, you've grieved long enough. Oh, well, you sat there crying over this long enough. But it's not until enough is enough for you as an individual have you arrived at the point where you can begin to move through these stages. And it doesn't mean that you won't go back and forth. You might actually get pretty good and you might have accepted it. And then this is your first Christmas without your loved one. Once again, your cycles will start back again because now you're angry they're not here with you. Now you begin to get depressed. So it's not a clear, we're going to do 1, 2, 3, 4, 5 and stop, it's over forever. So grief is a process that you're going to carry pieces of it with you for the rest of your life. It's just how you manage those pieces in the process.
Wow, that's great. Thank you so much, Dr. Davis. And we're going to get to Dr. Allen next. But one of the things that comes to my mind as you were speaking is the fact that as a strong Black woman, as a social worker, as someone that tries to help other people, I hear a lot why, especially from my mom, why did this happen? Why my son? Why did this have to happen?
Right.
I'm sorry, I'm a little emotional. But to try to help somebody else, the only thing I'm left with was the fact that I had no words. I'm trying to figure it out myself. I have no words for her.
But your faith traditions help to determine what that is, why this happened, and how you resolve that. So from my personal experience, when my son was 15, he was diagnosed with dilated cardiomyopathy, which is the worst form of congestive heart failure you can have. So we went from healthy to heart transplant in 17 months. He had not previously been ill. So you want to talk about a lot of questions like, why did this happen and what happened and how did we get here and what was missed and how was it? I mean, you have all of those questions, but part of you has to come to a resolve. So my resolve to him was, you need to, because when he was little, he referred to God as the big guy. So I told him, Miles, you need to talk to the big guy about this. That's the only part. All I can do is walk with you in this path. I can't make this right. I can't make you understand it because I don't understand it. But I will walk with you in this path as far as we need to go. And that was all I had that I could give. Because you're the mommy. You're supposed to have the answer. You're supposed to know the answers to the question. And I'm like, baby, we're in this together. And I mean, I said, he and I have since talked a lot about this pandemic thing. And we talk about how, as we were going through that, a lot of the things have paralleled because we're in this together. I mean, that was our mantra as he and I walked that path at that time. And so, we have done all of these things together. We have had to deal with that. But with the grief, we always ask that question. Why did this person have to leave? Why them and not me? The survivor's guilt is always there. But you have to decide that that's your faith tradition. Ours is that God makes those plans and we don't. Some other people have different faith traditions where they believe that the ancestors select certain people to come home at a certain time for a different purpose. So whatever your tradition is what you will hold steadfast to get you through your difficult times.
Thank you so much. We're going to bring in Dr. Allen, Dr. Vanessa Allen. Dr. Allen, can you just give our viewers a little bit, introduce yourself, a little background about yourself, and we'd like for you to jump right in.
All right, so I am Dr. Vanessa Allen. I'm originally from Washington, D.C. I am a medical doctor in family medicine. I went to Howard University as well, and I currently practice in Glendale, Maryland. in family medicine. I'm in private practice. And I also have a special interest in integrative and alternative medicine. So in addition to my regular traditional Western family medicine, I also incorporate, using your food as medicine. I do acupuncture, and I try to educate my patients about herbs and supplements.
Okay, great. Dr. Allen, the question I have for you is, during these uncertain times of COVID, the vaccine now, unemployment, social isolation, as well as distancing ourselves, it's also draining.
Mm-hmm.
It's just also draining. We're not able to hug each other, go to church. We're stuck in the house. We're gaining weight. Some of us have difficulty sleeping at night or sleeping too much, or it's just so much going on. We know that over time, these issues can lead up to more complicated mental health issues. How does the prolonged social isolation, the lack of sleep, the lack of motivation, how do these things affect us eventually? And what are some of the action steps that we can take now?
So all of those things you mentioned are all the physical manifestations of anxiety and depression. So sometimes patients will present with chest pain, shortness of breath, difficulty breathing, heart palpitations, insomnia, in addition to sad and depressed. At first, when the pandemic started, a lot of times you thought it was just like short terms, like maybe a day, 30 days, a month will be home, or 30 months. And then you said it progressed to like, now we're a year out. And so initially, yes, the anxiety was very intense in the first few months, but then, patients didn't have to leave their homes and they were working from home. So they had more flexibility and time in their schedules. And so some of the alternative behaviors came out that weren't necessarily in their best interest. So more alcohol, other drug use came into play. And then because they had access and they didn't have to get up so early maybe to go to work, they didn't have as many responsibilities after work. So instead of maybe just drinking on the weekends, it became to the point where drinking every day. And then then it got to my attention when it was just, physically they couldn't cope anymore and they knew they needed some additional help. So those are some of the things that I saw at the beginning of the pandemic that I had to really focus on as a part of my practice in order to address it or ask the proper questions in order to get that information. So some of the things that out of that you could do to, then the other thing is going back to the insomnia, that's been a really big part as you worrying all the time and obsessing about, what if things don't get better, or worrying about all the things that could happen, or maybe you had a little bit of anxiety that you were able to manage, but now with all the things piling on top of you, in addition, not to just the COVID, but the Black Lives Matter movement, the president's election, all of that was very stressful and all piling all at one time. And there was very little outlet, very little social connection. And so most of it is all watching TV 24/7 on your computer all the time. And you're just overwhelmed with all the information that we were getting. And so you have these thoughts that you just can't turn off at nighttime. And, then that also exacerbates your ability to go to sleep. And so on top of that, with the anxiety and the insomnia and maybe a depressed mood, they all kind of culminate at one time, and it's just too much for most people. So some of the things you could do, starting with your lifestyle is what I focus on, is looking at your diet. Some people took this opportunity to pay more attention to their diet and actually improve upon it. And, looking at, I promote pretty much a plant-based diet and seeing how they can make changes, especially if they're home and they don't have access to the restaurants and the fast food. How could they cook better or prepare better or plan better during this time that they have this, once in a lifetime opportunity to actually take care of themselves? So that would be one place to focus on, would be your diet, and adding more fresh fruits and vegetables in your diet, or coming up with some creative ways to incorporate more vegetables in your diet. And I recommend maybe start out, what is it that you eat right now, and where could you put some healthier foods in your diet, particularly looking at plant-based alternatives. Another thing is to look at the supplements, and the main supplements that help you with mood as well as improve some of the other maybe health aspects of your life, especially looking at it from a cardiovascular perspective, would be things like magnesium, which helps you to sleep and it's like a natural muscle relaxer, and it's also cardioprotective. Vitamin D, especially during the winter time when you're inside and you're not getting as much natural sunlight. Vitamin D also helps to stabilize your mood and is cardioprotective. And the vitamin B complexes. A vitamin B complex means there's more than one type of B vitamin, not just B12, which most people tend to zone in on. But there are other B vitamins that your body needs in order to make certain hormones that helps to elevate your mood. And again, it's also cardioprotective. So those are the ones that I recommend as far as overall, if you had to start somewhere, maybe with a good multivitamin, omega-3 fatty acids, and vitamin D. In order to help you with the insomnia, there are certain herbs that are more calming and, improve relaxation and help you maybe to go to sleep or to stay asleep longer. A low dose melatonin is helpful. And especially if you take it maybe 6 hours before bed, not immediately before bed, if you have trouble staying asleep. So if you take it right before bedtime, it might not peak until 6 to 8 hours after you take it. So I encourage people to take it like maybe at 8 p.m. if you frequently wake up at 2 a.m. or 4 a.m. Passion flower and valerian root are also helpful as far as promoting sleep and relaxation. And then there are certain herbs that are helpful as far as kind of like I say, overall wellness, especially more my adaptogens. And so these are the ones that help your adrenal glands to calm down. And your adrenal glands are your kind of like your fight or flight. So if you always stay in a constant motion of fight or flight, that's very difficult to maintain over a longer period of time. So you either become, wired and tired, or you're just tired all the time because you can't maintain that sort of energy. And so things like rhodiola, ginseng, cordyceps, which is a type of mushroom, those are all helpful, which help support your adrenal glands, as well as some of the other supplements I mentioned before. And then just for overall gut wellness or GI or gastrointestinal wellness, the probiotics are helpful because you think that most of your hormones for your brain are produced in your brain, but actually they're produced in your GI tract or your gut. So if your gut is not functioning well, your brain will not function well. So you really want to promote good health in your GI tract. I recommend taking a probiotic daily, and then that helps you have a better mental health as well. And then, of course, your physical activities as far as doing relaxation exercises, maybe first thing in the morning or prior to bedtime, allow your muscles to relax and some gentle stretches. And, a lot of times I use YouTube as a source to help me meditate or to help me wind down or do some muscle relaxation type exercises. And then making sure your room is as comfortable as possible. A lot of times, especially for menopausal women, the room temperature is very difficult to maintain. So you have to always keep on adjusting it, whether it's too cool or too hot. And then practicing deep breath or deep breathing type exercises. And then just the natural exercise of taking a deep breath automatically slows your heart rate down. And if your heart rate is slowed down, then that induces a sense of confidence and wellness. So those are my recommendations as far as, how can you adapt to a stressful environment.
Okay, great. Thank you so much. And we feel free if you're watching out there to ask any questions, and I could let our panelists know what your question is. I'd just like to pause for a moment and let everyone know that this is brought to you and sponsored by Howard University School of Social Work. So thank you, Howard University. The next person I would like to introduce and have her talk a little bit about herself and her background is Carol Arletta. Carol, can you just introduce yourself and give our viewers a little bit of background?
Yes, thank you, Florence. Thanks for putting this on and gathering us together. I am a licensed clinical social worker and have my practice in Prince George's County. I'm graduated from Smith School for Social Work and have been practicing since 1970. Fortunately, I have my practice here at my farm, which to me is so relaxing and tranquil, and part of the whole milieu for me is my animals, and I will be talking more about them as the time goes on. I work with adults and help them through the regular ways of dealing with their anxieties and depression. That's what I focus on. People come to me for that issue generally. PTSD, loss, and it's amazing. I don't say my pets, my dog, for instance, is going to be here, but people might meet him outside and ask if they can come in, and I certainly. So if that's of use and you feel comfortable with that, pets are very relaxing. They're warm, and the ones that are lap dogs and want to sit on your lap and you feel their warmth and their caring is relaxing. When you pet an animal, your blood pressure lowers. And there's so many areas about one's pets or borrowing one or fostering care can be very valuable to us, and especially in this very frightening time and where we are so isolated. And I'd like to talk a little bit more as the session goes on about what it's like to have this encompassing feeling of having an animal like a child to take care of. It depends on you, but they don't really ask for very much. They're very giving and caring, and you can tell when you're feeling emotional, and they just want to come up and be of consolation. And that's unconditional love.
Wow. Thank you so much, Carol. One of the things that came to my mind is as Vanessa, as Dr. Allen was speaking, you know, we have a lot going on in the world, riots, a lot, what have you. We're watching it. We're watching a lot. We're watching the news. We're watching social media. We're watching. And that affects your emotions. You get angry. You get sad. It's a lot of emotions going on with us. And then, you know, we may be drinking more or eating more or whatever. And, you know, we talked about supplements and things like that. When do you think that you know that it's time to seek help? When do you know? When is that point when you're like, okay, I need to see someone, in your opinion?
I think people find themselves breaking down crying. They're losing step with their reality. They're not getting up, or they're up all night. They, like you mentioned, they're certainly feeling angry. And I have to say, one of the things there, you can turn that TV off. You don't need to be in front of it. I could not look what was going on at the Capitol. I heard it on the news, and after a couple of hours, I had to turn it off because I was getting angry. I was crying. And what can I do? And I'll just go outside, night, day, whatever, and go for a walk, breathe in the air, take the dog. He's running loose with me, and it helps calm me down, because otherwise I won't be able to sleep. I won't be able to focus. And the anger, you're so impotent. What can you do? I mean, I have these awful thoughts of what I'd like to do. And, actually, one of the things I will say to a client, just say, you're not going to do it, but say how you feel. Say what you would like to do. Would you want to be Superwoman? Fly above these rioters and do what? Feel your power. Let go. Imagine. Because we go to the imaginary spot of being weak and impotent and helpless, which in reality, right now, what can we do? But we need to keep our strength. And what are the ways to that empowers each of us.
Anyone else want to touch on that?
I know. I said when Dr. Davis was speaking about feeling angry, I was like, no, I'm still angry. So I don't think I got to the next phase. You're right.
Oh, you're mute. She's mute.
I know.
Dr. Davis.
Oh, I said
I'm trying to go like this to catch your attention.
Okay, go ahead. So what were you saying?
Put yourself back on.
Oh my goodness.
and it's you get better. You're not angry the same way you were initially. You know, your anger changes, it grows and it develops. And part of that is your ability to be able to see it forming. Like Carol said, speak it. I mean, if this is what you really think at this moment, this is what you think at this moment. Don't act on it. We're not encouraging that. That's wrong. You know, but acknowledge that, you know, I have some deep emotional attachment and feelings about this.
Mm-hmm.
And I really think this, and, you know, you don't have to get consensus. It's yours. And I agree 100% with Carol. Cut off CNN, cut off the television, stay off of Facebook.
Oh gosh, yes.
All of those things, they keep this constant flow going, and you don't have a break. So when we look at the depression and we look at the anger, when you're watching this time and time and time and time again, there's nothing else but that. So you have to be able to take a social media break. If that, and for those who are not sleeping, if that means that as of 6 o'clock, you know, we used to watch the 6 o'clock news or the 11 o'clock news. Now we watch the news all day long. But if at 7 o'clock, you know, all news media needs to be off.
Let me also put in, this drives me absolutely crazy when I hear a reporter say, well, what should we worry about now? And I think, worry? Don't say that. What else should we worry about? And these people I thought were smart, but they keep using the word to keep the news alive, to keep us tuned in. And I'm thinking that is so detrimental. You know, what feels good now? Where can we find our strength and power? Maybe a little bit, but when I said, what should I worry about? Oh God, I don't know. Let me think. What can I worry about?
And especially for insomnia, they recommend, like, you know, turning off all electrical, you know, like whether it's your laptop, your computer, your phone, an hour before bedtime, and having a routine before bedtime. Whether it's, okay, I'm going to turn off everything. I'm going to turn off my lights, make my room as dark as possible. You know, keep the temperature as comfortable as possible. And maybe then you would start maybe your relaxation exercises, your yoga, your meditation, your prayer, whatever works for you. And then if you wake up during the night, do the same thing again. Just start the same routine over again.
Right. Because most people wake up and they check their phones.
Mm-hmm.
You know, they go on the internet.
Yeah.
So it starts all over again.
Or watch boring TV. Don't watch something that engages you. Watch a rerun. Right. I Love Lucy. When you know I was going to fall asleep. What did I miss? What did I miss?
Exactly.
But then there's that other side to it that you want to know what's going on.
No, I don't want to know that much.
No, let me put it this way. Some of us
get everything in a 30-minute news an hour, every hour.
Yeah. So, you know, with the riot, especially, you know, we found ourselves watching like we couldn't believe that this was happening in the United States. And I jumped on Facebook trying to figure out who's saying what is this all about? Do we know this person? Do we know that person? And I did have to turn that off, but I did think about the fact that they're in the United States Capitol, and a part of my background came into play, to be honest with you. When my previous days of working at the White House and worked for one of the Congress members and walking those same halls, it made me cry. It made me cry. To know the place that they were in was being trashed in that way. So a part of me really wanted to weep I really wanted to see. And it may be easy for some to turn it off, and it may not be as easy for others to turn off because of the disbelief. What do we say to those people? Because it can keep you up at night. It can keep you tuning in too much. It's just too much.
But I would say it's your choice. And if you want to keep your hand in the fire and keep it there, I can't keep it out for you. But why is it so important to burn? You have to be with them. You have to be with the people who are struggling. It's not making sense. We need a strong person to help them, not someone who's burning up.
That's true. Thank you so much for that perspective.
You continue to traumatize yourself.
Yes.
And the more traumatized you become, the more likely either you're going to become angry or you're going to become immobilized by fear.
Yes.
Because you're not going to be able to think clearly because it's just constant. And at some point, you have to stop and process. If you're constantly being fed something, you're not be able to process the information you have. And you're on overload. Everyone is on overload. You're on overload at home. So when you think about, oh, I needed to watch this, and I also needed to make sure my kids are doing their schoolwork because I'm homeschooling them because they're not going to class, and I have to do my job because my job is I have to do time then I don't have to do. So when we talk about people spinning out, they're spinning out because you're putting all of this internal pressure on you to do something that you don't really need to do.
Wow. Can you talk about that? What do you mean by spinning out?
Then you become very anxious. You become totally discombobulated from your life. You're not able to make accurate decisions. You're not able to complete tasks. So as you normally would finish your task or make sure you have an attitude, you don't finish what you started because you have so much on your plate that there's no way to get to anything. And so I think that if you put those things there, you have to control some of that.
Yes.
You have to say, you know what, this is a bit much for me. Yes, I would like to know, and I can tune back in at 12 o'clock. But I'm not going to listen to this from noon to midnight because it's too much. And I'll catch it because at 12 o'clock, they're going to repeat everything they said at noon. At 12 midnight, they're going to repeat all of it plus anything new that happened. So you're not going to miss anything. So you really have to begin to look at what your life looks like and what you want out of your life, because you are the person that is supposed to master that ship. So if you are mastering your ship, then you can't run everybody else's ship too.
Okay. All right. This is real talk. I love it. Thank you so much. Go ahead, Carol.
Yeah. But I was thinking of it's like a fable of this little girl that says to her grandma that I'm very scared to go out. It's outside. It's scary. I think there's the big bad wolf out there. And the grandma says, why? She says, because when I open the door, I see the wolf. And I said, what are you doing? She said, well, I give it some food just so it'll be nice to me. And the grandma says, if you would stop feeding the wolf will not come to your door, sweetie.
Wow.
Leave the wolf to starve and go elsewhere.
We're feeding the wolf. Oh, my God.
More wolf.
Thank you for that perspective. One of the things that Dr. Davis, when we were talking about grief and loss, I have a question. One of the viewers wants to know if there is a difference based on gender and how we process grief and loss.
There are gender differences. There are age differences. Every difference you want to make for human being is in grief and loss. You will find that some we talk about males, some of them don't address it at all. They just try to push it under like, okay, well, it's happened, it's done, and I'm over it. Then they say that there's a female who's overly invested in it and is very histrionic all the time to the point that you're like, okay, now get over it. Okay. So then you have older people who say things like, well, when you get to the age that I am and you've arrived at this point, people are going to die because you're at a certain age and most of your friends are going to die. So you handle it a little differently. So that's why I say grief and loss is really an individualized occurrence. I mean, you can go to therapy. We can help talk you through your process, but your process and my process and our next door neighbor's process are all going to be different. And we could have all experienced it at the same time, but the process is going to be different because it's how you internalize that process. That if that makes a difference, it's how you solve problems. Some people get mad and go home into their room. Other people break down and cry even when they're mad. They just cry and work it out. So it's a mechanism of problem solving that each individual does differently.
Anyone else? And we also talked about the loss, dealing with grief, even though humans could be one way, but what about the grief, the loss of a pet? We talked about that. Some people would like to know about that as well.
Yeah, I've been involved probably for 30 years with pet loss before it became popular. I've had my own pets and friends with their pets, and it's so sad. It's sometimes the only live creature that understands them, that they feel comfortable with, that doesn't criticize. And there's a wonderful association for people out there, Association for Pet Loss and Bereavement, APLB.org. And they have a lot of groups online that help people with their animals. I've had people come here from cats, dogs, horses, dealing with that kind of interaction. And a pet I have is a parrot. And you would think, dogs live maybe 12, 14, 16 years and they die and our heart's broken. Parrots live 60. I'm trying to figure out what to do with my parrot. She's the executrix of my will, but I need to find a place. And they're very smart and very sensitive, very interactive. And I've heard today someone saying people now being alone talk to themselves a lot. And well, I've for years talked to the parrot because she answers back. And we'll start laughing, or we'll, my one parrot I had would do opera. So there's a very strong connection. And so I walk in, hello, how are you? And it's so touching. And they're not just mimicking, they really connect. They're very detailed. They see little minute things. So animals go through this. The people with the animals go through the same grief process of all the, I should have done something better. It's my fault. I should have. And we just put all the blame. I'm not a good mother to my animal, my child. I did it wrong. I chose the wrong vet.
You had mentioned the benefits of having a pet.
Yeah.
Are there certain pets? You mentioned a parakeet. To me, I would never even think about getting a parakeet.
A parrot, a big parrot, not a parakeet.
Oh, okay, a parrot.
Yeah, but I had a parakeet when I was a little girl, and it was the sweetest bird. It would fly on my shoulder, and the little voice say, hello. But I have a bigger bird now that's very intelligent. The thing, I've always had dogs. And one of my thoughts about coming here today is when I, having a pity party, I go, oh, I'm so miserable. I can't do anything. And I go, wait a minute. I got these guys depending on me. And if I don't get up at 7, at least, I'm going to hear the dog. I'm going to hear the parrot saying, hello. I gotta get up, feed the dog, go down to the barn. Horses are whinnying, hi. feed me. It's all about food, but that's okay. That's okay. And one comes over and nuzzles me, and and it feels good. It feels good, and I take care of all this. And I'm awake now. It's 7 a.m, 29 degrees, and I'm awake, haying and doing stuff. I come back and then uncover the parrot, and I say good morning to her, and how are you? And she comes over, does little kisses on the side, and I give a little, well, I missed you too, and make special stuff for her. And then I sit and eat. And I think I feel important. I feel useful. They really depend on me. They love me, different degrees, but they and my geese and my swans. I come in there and they expect certain things, and I feed them. If you walk in, they'll say, "Who is this person?" And they will not give you the nice greeting. They will be hissing at you or looking very, like, who are you on my property? So I'm recognized, and I feel a bond. And I know when the geese or the swans pass, they're about 20 years old now, I will cry because they're part of the whole fabric of how I live.
Right. That's great. And someone wants to know, okay, so we talked about pets as a form of therapy. What are some other alternatives, some other therapies like music therapy or some other types of things we could think about when it comes to healing ourselves? Anybody?
Yeah. Well, art. Whether it's painting, drawing, ceramics, jewelry making. You're focusing, you're doing something that you feels beautiful. Someone else admires it. Oh, and you say, I made that. It feels good. And
Dr. Allen, I'm sorry.
As long as you don't eat all of it.
Go ahead, Dr. Davis. What did you say?
I said baking is very good as long as you don't eat all of it.
That's the problem.
I think Dr. Allen was also going to chime in.
Sometimes I encourage patients to keep a toolbox. And in your toolbox, you have all the things that you like. And it doesn't have to be a major thing. In your toolbox, you might have your favorite playlist, or you might have a favorite scent or a lotion. So you can go in and, put your lotion in and inhale some type of aromatherapy, or, a favorite verse or a poem that you like. So if you're not having a good day, or if you're having a good day, instead of celebrating with food necessarily, go into your toolbox and you pull out something else that you like. So you have these things set aside because there are going to be days that aren't always your best days, and just kind of have a reserve.
Yeah, that's great. I love that.
That's great. Dr. Davis talked about baking. I'm with you because I like to cook myself, and you're right. As long as you don't eat it. I think when COVID first started, I cooked everything in sight. I was trying to think of new ways to cook things, and I know I gained that COVID-15. So but to me, it is very therapeutic when you're in the kitchen and you're making something and putting it all together. So I do have someone that has a question, and it's a question and a statement. How do you help a young person who saw a loved one die in front of them? Okay. And a lot of deaths now due to COVID. So we did touch on that, but she's specifically talking about a young person understand this, especially when they die in front of them.
I would suggest that the person go to therapy. I definitely would think, because the family members who are trying, and the family has to support them, but the family members that are trying to be supportive are also grieving. And so some of it is difficult for you to maintain that in multiple roles. So if you have them to go into a therapy situation, they can kind of talk through their feelings, because sometimes we inadvertently say things to children that we are not intentionally meaning them the way they're taken. And things like, well, you're a big boy, these things happen, you should be able to take it. That statement says, I can't really grieve with you. That's not what it's meant to say, but that's what's received. And I think that a lot of times when people make statements to kids, or that, you were so brave to be there. Okay, and that still doesn't mean I'm not afraid. It still doesn't mean it's not scary. But I was brave, and I'm supposed to be brave, so I can't say that I'm still terrified.
Yeah.
So you really have to think about how you use your words, and it would probably be helpful to have someone else help to intervene with the babies.
That's a great point, Janice. Yeah. Be a brave little man. You don't need to cry.
Yep.
Yeah. You think that's not helpful.
Right. So don't tell someone, it's like, you're not validating their feelings.
Exactly.
Right.
Give them
But
permission, yeah.
okay. So there comes a point in time when you may feel like you're not able to help this person. So you may recommend a therapist. Because we talked about, when do you know that you need a therapist? So and then you talked about spinning out and things like that. So those are the times, and some viewers may have some loved ones in their family that when they see certain behaviors, they may have to tell that loved one, hey, have you thought about seeing someone about that, or something in a nice way?
Well, a lot of that is stigma or the lack of understanding of what is available to you. So a lot of people won't go to therapy because they feel they're not supposed to go to therapy, especially people of color. And a lot of people will feel that it means you're weak if you go to therapy. If you talk to somebody else, you're weak. And unfortunately, a lot of people don't have good friends or good support groups that they can talk to in other areas. So sometimes you just need an outside person to sit down and talk it out with. You can make the recommendation, you can make the offer. It's up to the individual. You can force a child to come into therapy. They will sit there for an hour and do absolutely nothing. And then they'll leave. And so they have to understand the value of it, and you have to work with them to get to understand the value of it. But a lot of people are just afraid, and you keep your personal business personal. You don't tell your business to everybody. So you're not going to go to therapy and spill your guts. You're just not going to do that. So really have to help people understand that this is a place for you to talk. I often say, you think about years ago, therapy was being done, but like 50, 60 years ago, knowledge was passed by women and men sitting in spaces and talking to one another and spending time shedding light on things that you don't necessarily, when you're young, you don't really know that they're giving you valuable information that you can use later in life. But as you gotten older, you kind of look back and it's like, I remember when those ladies used to talk about that.
Yeah.
But we don't have that. There are generations that have been raised that don't have that type of grounding. And so they don't know where to go to ask for help because they've never been in a situation where they've seen that type of community of help.
Right. That's very, very true. And sometimes, we talked about supplements and walking and exercise and things like that. But sometimes people just want to zone out. They want, like you talked about, drinking more, or it may be smoking more, or they want a pill to just fix things, or just to be out of it. So, anyone, how can you
come see their family medicine doctor first? Well, they don't really know how to put a diagnosis on it, but they know something's not right. And then when I talk to them, depending on, how severe I think it is, I try to give them resources. A lot of times their mental health is separate from their medical health as far as their insurance is concerned, and they have the information, they just don't know how to access it. So if they do have insurance, I say, you do have mental health services, and they try to make them easily accessible during these times. A lot of the therapists are doing telemedicine as well as the medical doctors. I say, you can do telemedicine for your therapy, and therefore it's, it's not inconvenient. It's not as stigmatized because it's, I'm just talking to them right at home. I don't have to make an extra effort to go see somebody. And then there are also community resources, like say in the state of Maryland, I think if you dial 211, that'll connect you with somebody to kind of help you sort out what do you need. Is this an emergency type situation, whereas you think you're suicidal, versus I just need somebody to talk to. So I try to give them those kind of resources that, they could do in their own space and their own time, so that if they wanted to talk to somebody, they could.
And Dr. Allen, when do they come see you? I mean, have they reached a certain breaking point? Is it
A lot of times when they're getting overwhelmed, they'll give me a call, or they'll schedule, or like I said, they can't put it all together. Like, chest pain is a biggie, and they know that chest pain is really important. But once you try to, sort it out and realize that it's not a cardiac type of chest pain, you say, I think this is, probably not cardiac. It's probably, stress and anxiety. And then I say, and then I'll, I don't want to not hear them about the cardiac concerns that they have. But once I rule that out and I ask all the appropriate questions, I'll ask them about, what kind of stressors are going on, or what, is there anything going on at home or with your job, anything like that. And then that's when they'll open up and they'll say, well, I really am feeling overwhelmed. I don't really like working at home all the time. They, a lot of people who work at home now actually do more work than what they did in their office, because there aren't as many distractions, and they have to do the homeschooling with their kids. And so it is a lot. And then plus all the other external stimuli. And so a lot of them feel overwhelmed, and they're looking for something.
Mm-hmm. And we just have a few more minutes left. We have Dean Crew who is viewing us, and Dr. Davis, you did touch on the listening in on grown folks' conversation, so to speak. Now, and she brings up a good point about it being an intergenerational approach to our experiences. But when I was coming up, I came up in a generation where children should be seen and not heard, and you don't get into grown folks' conversations.
But you still could listen. Remember, you were at the kitchen table too. Yeah. You just couldn't open your mouth.
Yeah.
Okay. So, and that brings up a point. We do talk about our children and what they're exposed to today, as far as so much going on with the riots and Black Lives Matter. How much is too much? I mean, we're all talking about it. They're listening. How is it, it's impacting them some kind of way, just like it may have impacted us when we were growing up. If we were all growing up in the 60s and the movement and everything like that, it's impacting them. So what is too much? When do we, when do we turn off that TV or move the conversation somewhere else, or move them out of the room, or do we just let it be?
That's a personal call based on the parent and the child, because some children are better able to absorb that information and not be as traumatized by it. If you know your child, this will be very dissettling for your child. You need to not put them in that situation. Yeah. And that comes with talking to them. There are ways in which to talk to them about all of this, but they don't need to constantly have a barrage of that information. They don't need to constantly sit and watch CNN all day long. I mean, the adults don't need to do that. The kids definitely don't. And they don't necessarily know the lines that connect the dots. So you're expecting them to connect adult dots and lines, but then you're telling them they're a child and don't participate.
Yeah. Wow. Okay.
So there's a balance. You have to be able to talk to them so they're informed, but at the same time, this does not consume their world.
Gotcha. Thank you so much. With this last minute left, any final closing points on taking back our mental health? There's got to be a change. Let's start with you, Dr. Allen.
Well, like I said, practice self-love, and have a whole mind, body, spirit approach to it, whether it's getting outside counseling or doing something good for yourself. paying attention to what you eat and what you drink and what you put in your body, and what are you getting rid of out of your body as well. And then what is your spirituality? What do you connect with, or who do you connect with? And try to make some type of connectivity, either with a higher power or with other people.
Okay. Dr. Davis?
I agree with Dr. Allen. You definitely need to be able to be aware of who you are. And I think that is the key fact. Know who you are, whose you are, and where you are in whatever you're doing. And that way you're in a better place to make a better decision.
And Carletta? Carletta?
That's close. Besides dittoing the both of you, I'd say start giving things to other people that makes you feel good and makes them feel good. Go to your neighbor with your extra food and say, you want to share this? Do you want me to walk your dog? I'm going to the store. Can I pick something up for you? I think those gestures are very special right now.
Great job, panelists. And once again, thank you, Howard University School of Social Work, for sponsoring this event today. And I just received a message that the Howard University School of Social Work has a monograph on mental health and COVID in the Black community. Dr. Davis has an excellent article on grief and loss, and the monograph is available by visiting their website at www.socialwork.howard.edu. And also, thank you, viewers out there in Facebook world, for tuning in. And let me just leave you with, if you would like to make a donation so that we can keep events like this going and keep advancing our cause in closing the gap in disparities, please visit our website at openmyheartfoundation.org. Please leave a donation for us so that we can continue our work. Please join us again next week when we'll have another discussion on real talk, real health talk on issues in our community. Thank you. Thank you so much, panelists, for joining us.
Nice meeting you.
You're welcome.
Thank you. Bye-bye.
Bye-bye.